Dr. Jacoby's patient has delivered a 3.6 kilogram infant born at 39 weeks. When delivered, the baby boy is flaccid and is not breathing or crying. He still is not breathing, but you auscultate for a heartbeat and note that the heart rate is 56 beats per minute. 1. You know that a normal heart rate for a newly born baby is A. 60 beats per minute, B. 72 beats per minute, C. 80 beats per minute, D. At least 100 beats per minute. Correct answer, D. At least 100 beats per minute. The infant begins to have some gasping respirations. You reposition the infant and begin positive pressure ventilation using a bag valve mask device at a rate of 50 breaths per minute with an oxygen concentration of 21%. Another team member applies a pulse oximeter and a cardiac monitor. As you provide PPV for 15 seconds, you instruct the team to do a quick assessment of the newborn. 2. The most significant finding of successful resuscitation of this infant is A. Decrease in cyanosis, B. Increase in heart rate, C. Increase in oxygen saturation, D. Increase in the movement of extremities. Correct answer, B. An increase in heart rate after 15 seconds of PPV is a good indication of the success of lung inflation. The team member doing the assessment announces that the chest is rising and the heart rate is still at 56 beats per minute. As the resuscitation team leader, you go through the Mr. SOPA interventions to improve ventilation and increase the heart rate. After an additional 15 seconds of PPV, the team reports that the infant's heart rate has not changed. 3. You know that the next intervention you must do is A. Apply a laryngeal mask, B. Increase the respiratory rate, C. Intubate the baby, D. Increase the PIP on the T-piece. Correct answer, C. Intubate the baby. The fact that the heart rate has not increased is an ominous sign and indicates that the ventilation and oxygenation are not adequate. The infant is quickly moving toward full cardiac arrest. As you prepare for endotracheal tube insertion, you instruct the team to begin chest compressions. 4. The correct rate for chest compressions for an infant is A. 60 per minute, B. 90 per minute, C. 100 per minute, D. 120 per minute. Correct answer, B. Compression should start at 90 compressions per minute. As chest compressions and PPV continue, you intubate the infant and order the oxygen concentration to be increased to 100%. 5. After intubation, chest compression to ventilation ratio should be A. 2:1, B. 3:1, C. 4:1, D. 5:1. Correct answer, B. 3:1. The team must avoid giving chest compressions at the same time a PPV breath is delivered. It is helpful for the team member to do compressions by counting 1 and 2 and 3 and, at that point, the compressor stops doing compressions and says breathe. At that cue, the team member handling the ventilation should deliver 1 breath. The team is providing PPV with visible chest rise in coordination with the chest compressions. At the end of 60 seconds, the team stops CPR and looks at the ECG monitor to determine the heart rate. The heart rate on the monitor is still 56 beats per minute. 6. At this point, the team should A. Stop compressions, B. Resume coordinated compressions and PPV. C. Continue PPV only. D. Do a full assessment of the infant. Correct answer, B. Resume coordinated compressions and PPV. This is only the first assessment since starting compressions, so lack of increase in heart rate should indicate that CPR must continue. 7. The best intervention now is to A. Establish a route of medication administration. B. Increase PPV rate to 40 to 60 per minute. C. Stop coordinated compressions and PPV. D. Increase compression rate and continue PPV. Correct answer, A. Since the team cannot get the heart rate above 60 with compressions and adequate PPV, the team should establish a route of medication administration. 8. The preferred route for administration of medications in the newly born population is A. Peripheral IV. B. Endotracheal tube. C. IO. D. Umbilical venous catheter. Correct answer, D. The umbilical venous catheter is the preferred route of administration. The intraosseous route is an acceptable alternative. 9. The medication that can be administered through an IO site include A. Only epinephrine. B. Only sodium bicarbonate. C. Only epinephrine and atropine. D. Any medication that can be administered through the umbilical vein. Correct answer, D. Any medication that can be administered through the umbilical vein can also be administered via IO access. The umbilical cord is still clamped. The team leader determines the umbilical vein will be the route for the vascular access. The person who will insert the umbilical catheter assembles the equipment and asks the team to stop compressions. 10. The first step in the insertion process is to A. Clean the umbilical cord with an antiseptic solution. B. Cut the umbilical cord below the umbilical clamp, closer to the baby. C. Cut the umbilical cord above the umbilical clamp, closer to the mother. D. Cut the umbilical cord as close to the mother as possible. Correct answer, A. Clean the umbilical cord with an antiseptic solution. Remember that you will be exposing the baby to contaminants from the external environment, so every effort should be made to minimize this possibility. You clean the umbilical cord and cut the umbilical cord approximately 2 centimeters above the baby's skin line in preparation for inserting the umbilical catheter. 11. When looking at the cut end of the umbilical cord, you know that the umbilical vein is at the A. 3 o'clock position, B. 6 o'clock position, C. 9 o'clock position, D. 12 o'clock position. Correct answer, D. 12 o'clock position. The umbilical vein is usually the largest of the 3 vessels in the umbilical cord. The 2 smaller vessels are umbilical arteries. You insert the umbilical catheter into the vein until you see a blood return into the tubing. The team continues compressions and PPV. The team has epinephrine with a concentration of 1 to 10,000. 12. As a team leader, you know the correct dosage for epinephrine via the umbilical vein is A. B. C. D. Correct answer, A. You give the initial dose of epinephrine and flush the stopcock with normal saline. 1 minute after giving the epinephrine and continuing CPR, you ask that CPR stops so you can see the heart rate on the cardiac monitor. You note that the heart rate has not increased. You order CPR and ventilations to resume. You order a second dose of epinephrine. 13. Epinephrine can be repeated every A. 1 to 3 minutes, B. 3 to 5 minutes, C. 5 to 7 minutes, D. Epinephrine should not be repeated. Correct answer B. Epinephrine can be repeated every 3 to 5 minutes with no upper limit. You give the second dose of epinephrine and flush the stopcock with normal saline. 1 minute after giving the epinephrine and continuing CPR, you ask that CPR stops so you can see the heart rate on the cardiac monitor. You note that the heart rate is still less than 60 per minute. 14. Additional considerations of things that might be affecting heart rate should be A. Low blood volume, B. Pneumothorax, C. Displaced ET tube, D. All of the above. Correct answer D. All of the above. All of these might cause a decrease in the baby's heart rate. After another dose of epinephrine and continued compressions and PPV for 60 seconds, the team stops CPR. The cardiac monitor now shows a heart rate of 120 beats per minute. You prepare the baby for post-resuscitation care.